Here in Clovis, New Mexico with Dr. Scott Forman. He has been a practicing physician for 12 years and a board certified emergency medicine physician for 9. And we're just here to ask him a few questions. Scott, thank you for joining us today.
Of course, it's a pleasure.
Thank you, always a pleasure. What made you end up here in New Mexico, out of all places?
So there's something called the match, where you go through and you apply to different residency programs, and then you rank them in order after you've interviewed at each one. Mm-hmm. And so I ended up being fortunate enough to have the opportunity to interview at over a dozen different programs throughout the country. And at the time that I ranked them, I ranked University of New Mexico #1, and they appeared to have ranked me quite high as well, and so the match was made.
That's awesome. Obviously, being a doctor, there's an unbelievable amount of responsibility that you carry with you, having patients and just knowing that you're responsible for a lot of what happens to them. And with that, I just want to know, during your first few years of practicing medicine, did you ever feel any inadequacy or anxiety for practicing on patients for some of the first times?
I'll tell you what, Diego. I remember the first patient that I ever saw out of residency, and I remember that feeling of angst and anxiety and insecurity, and it was truly a life and death situation. Certainly the vast majority of the interactions that I have with patients are not, but on that particular occasion it was, and my training absolutely created a motor memory that saved me and saved the patient at the same time during that experience. But that feeling, that persistent feeling of wondering if I'm going to make the right decision, if what I do is going to make a difference, if that difference is the right difference to make, has been a part of every patient interaction that I've had since I completed my training, and certainly while I was doing my training initially. So it never goes away. Mm-hmm. I always have fear and trepidation. I think it's healthy. Keeping it in check is certainly critical. Otherwise I'd be paralyzed by it. But
definitely.
It's I think the most important component of my practice is maintaining a degree of humility that keeps my ego in check, that keeps me eager to learn more, to stay always on top of the newest innovations, the newest evidence-based medicine practices, responsible stewardship with the clinical practice that I endeavor to maintain.
Now, I know one memory that I'll never forget is a couple of years ago. I think it was for Memorial Day. I was playing basketball with your son Skylar, and there was an accident. And long story short, a glass shard had cut deep into his calf, and he was bleeding everywhere. And I was freaking out, and he remained pretty calm. But I just remember you coming and in the front yard stitching his leg up, and I was just thinking about how lucky we were to have you there for him in that moment. And on that note, I want to know, what is, if you can pinpoint it, what is the most significant instance in which your career as a ER physician has helped you in your own personal life?
Whew. I think that my practice has been riddled with countless epiphanies of just you alluded to it, the magnitude of what I do on a daily basis and the lives that I touch. There's something about the practice of medicine in general, but I'd say more so that emergency medicine is different, and the practice of emergency medicine has compelled me for the reason that I see patients at their most vulnerable. They entrust that vulnerability to me, and there is no greater service that I can perform than to acknowledge that vulnerability, to allow them to be vulnerable and to not exploit that, and to create comfort and promote healing, or at minimum to maintain their integrity throughout whatever process they're experiencing. All of that resonates in a way that makes me a better person. If I were to compartmentalize the authenticity of those interactions, then I would be doing myself a tremendous disservice in what I can learn and how I can be a better human being.
Wow. On another note, where are the most notable places in the world that your job has taken you?
I've diversified my practice a lot, and so I don't just work in the hospital, but I also work as a medical director for an international disaster response team. It's taken me some pretty interesting spots. I've been in Africa, South Africa, and in Kenya as recently as the last 3 months. I've traveled all over the South Pacific. I traveled to Bangladesh a few months ago. Those are all super interesting places, and it's a great opportunity to see different cultures and experience those cultures in a very special way. I mean, when you're treating patients in those environments from those cultures, we're all human beings with similar anatomy and physiology, but the point is that those cultural differences and even the practice differences in the physicians that I've met who are native to those populations are different, and I've got a lot. I've learned a lot from those experiences. I'd say that those are probably some of the best and most gratifying, worldly experiences that I've had.
Yeah, definitely sounds that way. Have you ever experienced any major ethical dilemmas while practicing medicine?
I have. I've had probably more ethical, medically ethically challenging experiences than I can even remember. Some of the most notable ones were anything ranging from having to make a decision about performing a blood transfusion on somebody who adamantly refuses one. I've had countless situations with end-of-life care when it may or may not appear to be in the patient's best interest to do interventions that may prolong quantity of life over quality. People make interesting decisions when they're perched on the precipice at the end of life, sometimes making decisions that are contrary to written documents that would have us do something to the contrary of what they decide to retract verbally. So those are a few of the many ethical dilemmas that I've encountered, and ultimately I'm not so sure that they're ethical as much as they are hard, because they're hard decisions for anybody.
Yeah.
withdrawing life support, making a decision whether to initiate life support measures or extraordinary measures, can be horrible at any time. I'm conflicted about some of the most important patient encounters that I have with patients require time spent with them and their family members and their loved ones, and often I don't have that time just because of the sheer volume of patients I need to treat in a given shift over a given period of time. And so ethically for me, that's complicated and difficult to not be able to spend the time that I feel like I would want or need if I were the patient or I were the family member with the patient. And I always want to treat people the way I would want to be treated, or I would want a family member to be treated if the situation were reversed. And that's not always the easiest thing to do. It sounds simple, but in practice it's immeasurably complicated.
No, definitely very understandable. Now, on the drive over to Clovis from Albuquerque last night, Skylar and I were doing our research, and we found out that the average ER physician, their career doesn't span for very long, mainly due for the demanding nature of the job itself. And what I want to know is, what has kept you in this job for so long?
What you're alluding to, Diego, is something called physician burnout, and that is something that I've experienced the full magnitude of. And I must say that predictably it happened right around the same time frame that is known to be the average career expectancy for most ER physicians, and that's approximately 5 years after completing residency. So if you think about that investment for a second, 4 years of medical school, 3 to 4 years of residency, depending on where you go. 8 years of training to practice as an attending emergency physician for 5 years. For me, it became obvious in a short period out of residency that I needed to diversify my practice as much as possible to be able to continue to practice clinically for as long as possible. And I've done so by pursuing careers as a medical director, in doing flight medicine, in doing expedition medicine, in doing humanitarian outreach. All of those things have helped keep me balanced. They've been able to provide a much better breadth of clinical experience, of learning, of opportunity to see the world, as you alluded to before, and have made my return to clinical practice much more gratifying and sustainable. So to that end, I've been able to stave off burnout. I've been able to continue to find the kind of rewarding patient interactions that I always enjoyed early on in my practice, now later in my practice.
Well, Dr. Forman, that's all we have for you today. Thank you for taking the time.
Of course. Thanks so much, Diego.